Welcome to the podcast, folks. Today we're delving into some really crucial topics for senior health. Everything from bodily changes and common diseases to lifestyle shifts, exercise, diet, and even the role of hospitalists.
I'm excited to jump in. Yep, so what are the key areas our discussion is covering?
Well, we have a broad spectrum here. We're looking at the physical changes that occur as we age: skin, bones, muscles, vision, hearing, and even dental aspects. Then we move to the 16 common diseases affecting seniors, social issues, and lifestyle recommendations like diet and regular exercise.
That sounds like a lot. And when you mention bodily changes, are we talking about the natural aging process or underlying health issues?
It's both, really. Some changes, like thinning skin and decreased muscle mass, are natural, but these changes can sometimes signal underlying issues like osteoporosis
Mm,
or arthritis. They explain how these bodily shifts can influence mobility, balance, and even cognitive functions.
interesting. And how does that tie into the common diseases seniors face?
Right, so think about it. As our bodies go through these changes, conditions like cardiovascular problems, diabetes, and neurological issues like dementia can creep in. The input highlights a range of problems, from heart disease to neurological issues, even musculoskeletal concerns like osteoarthritis. It's all interconnected.
Yeah, that interconnected nature is pretty profound. But what about the social aspects? I noticed there were social issues mentioned as well.
Absolutely. Social factors play a huge role. Seniors often face loneliness, isolation, and sometimes even financial stress after retirement. These can significantly impact both mental and physical health. It's like how, the social environment can either buffer or exacerbate health issues.
Yep, sounds like these social issues are as important as the physical ones. So, what lifestyle changes can really help seniors live healthier lives?
Great question. The content emphasizes that lifestyle modifications, like a balanced diet and regular exercise, are key. Besides that, things like moderating alcohol intake and quitting smoking add up. It's really about a holistic approach. Nutrition, exercise, preventive screenings, and even engaging in social activities can make a big difference.
I love that holistic approach. But don't you think sometimes these guidelines seem a bit generic? I mean, shouldn't there be personalization in these recommendations?
That's a fair point. While the guidelines offer a solid baseline, like they suggest exercise regimes of 3 to 5 times a week for about 30 minutes, they do need to be tailored to each individual's needs. Your personal history, physical limitations, and even your local environment play a role.
Mm.
So, yes, personalization is key.
And speaking of exercise, the benefits mentioned are really compelling. Can you give us some examples?
Certainly, regular physical activity can help with weight management, improve cardiovascular health, and even boost mood and sleep quality. It's like when you exercise, you're not just burning calories, but also building endurance and reducing the risk of falls. The routines, walking, swimming, or even balance and resistance exercises, target
Right.
various parts of the body. It's a win win.
I can totally see the benefits there. Now, what about diet? How is that emphasized in senior health?
Diet is a major pillar. Seniors are advised to stick to balanced meals with plenty of fruits, vegetables, and whole grains while avoiding empty calories from snacks like chips or soda. Portion sizes are highlighted too because even the healthiest food can be a problem in excess. Keeping an eye on caloric intake while getting the necessary proteins, fats,
Mm-hmm.
and vitamins is crucial. It's all about balance.
Makes perfect sense. And then there's the issue of routine medical tests. That sounds like it must be a big part of early detection.
Exactly. There's a detailed rundown of recommended screenings like influenza and pneumonia vaccinations, cancer screenings, bone density scans, and even lipid disorder evaluations. These tests are designed to catch conditions early, ideally before they become severe. It's very preventive medicine focused.
Yeah. And I assume these tests would then inform the care plan your regular doctor or even a geriatrician might devise?
Correct. Geriatricians, as specialists in elderly care, tailor treatment plans based on these findings and personal history. They also work to manage medications to avoid adverse side effects and interactions. The idea is to keep seniors as healthy and independent as possible.
Yep, exactly. That sounds like a crucial aspect of care. Now, what about safety measures? The content seemed to give a lot of practical recommendations there.
Right on. Simple, yet effective, safety measures are advised at home. For instance, using walkers or canes, installing better lighting, reducing slippery surfaces, and even registering with alert systems in case of emergencies. It really all adds up to creating a safe environment and
Mm.
preventing falls or other injuries.
And these measures would certainly support seniors in managing their daily lives confidently, huh?
Spot on. The aim is to help them maintain independence while minimizing risks. This includes considerations not only at home, but also when out and about, like safe driving practices and planning for emergencies.
Now, one last point caught my attention. Hospitalists. What exactly is their role in senior care?
Ah, yes, the hospitalist role. Hospitalists are physicians who manage the care of patients, especially seniors, when they're admitted to a hospital. They work in conjunction with primary care doctors, taking over while patients are hospitalized and then hand things back over once the patient is discharged. It's a system designed to improve availability and expertise for urgent in-hospital
Yeah,
care.
I see. So, while it might seem a bit disjointed at first, switching from your regular doctor to a hospitalist, it actually streamlines the care process in a hospital setting, right?
Exactly. It's designed to reduce risks like medication interactions and complications from hospitalization, such as delirium. By having doctors who specialize in inpatient care, the system minimizes the potential decline in health that can come from a hospital stay.
Mm.
It ensures a smoother transition back to regular outpatient care.
It's a smart system overall, balancing specialized attention during hospital stays with continuity of care after discharge.
Absolutely. And the detailed discussion on hospitalization even goes into how things like frequent nighttime disturbances and the use of unfamiliar medications can, trigger confusion or delirium in
Yeah,
seniors. That's why a careful approach is needed. It really emphasizes coordinated care.
it's impressive how these topics weave together: the physical, the social, the preventive interventions, and even the health system's structure.
Totally. It's like a comprehensive roadmap for healthy aging. Even subtle changes in skin, memory lapses, or balance issues are seen in the light of overall well being. And by being proactive, like reviewing medications, sticking to routine checkups, and modifying lifestyle, seniors can really optimize their health outcomes.
I also appreciate that the discussion doesn't just focus on the negatives, but rather encourages effective steps, like exercise and dietary adjustments, which have a positive ripple effect on conditions like heart disease, diabetes, and depression.
Exactly. And let's not forget the emphasis on social engagement, addressing loneliness, staying active, and even taking vacations. All these aspects can boost mental health and overall quality of life.
Right. It seems like the overarching message here is that while aging brings its fair share of challenges, being informed and proactive can really make a difference in a senior's life.
Yes, indeed. The information is all about taking control, no matter the stage of life. Whether it's regular health screenings, adapting homes for safety, or simply engaging in meaningful social activities, each step builds a stronger foundation for a long and fulfilling life.
I must say, this approach strikes a balance, addressing physical changes, medical necessities, and lifestyle aspects without overwhelming anyone.
Absolutely. And in the end, it's about creating a supportive environment, both medically and socially. Even though aging is inevitable, these strategies really empower seniors to stay active, safe, and
Yep.
connected.
Wow, there's so much depth here. It really puts into perspective how holistic the approach to senior health should be. Thanks for unpacking this.
My pleasure. It's a multifaceted subject that reminds us that healthy aging is as much about our choices as it is about the natural process of aging. We'll keep exploring these topics, so stay tuned.
Looking forward to it. Thanks for the insightful discussion, everyone.